In this video, we're going to cover key things that you need to know about fibroids, which are non-cancerous growths that can form in the walls of your womb, which is medically referred to as the uterus. You can have one or more, and they can vary in size. So first of all, how common are fibroids? Well, fibroids are actually really common, and they affect almost 8 in every 10 women. They're made up of muscle and fibrous tissue, and they usually grow slowly over many years. And new fibroids can also develop over time. But when you reach menopause, fibroids often shrink because of the hormonal changes that your body goes through. Now, there are lots of different types of fibroids, and in this section of the video, I'll explain 4 of the main types and what they're called, plus where they're located. So fibroids are categorized based on where they grow in the womb. Intramural fibroids are those which grow inside the muscular wall of the womb. Subserous fibroids are ones which grow from the outer wall of the womb into the pelvic space. Submucous fibroids grow from the inner wall of the womb into the space inside the womb. And finally, something called pedunculated fibroids are fibroids which grow on a stalk. Now, the exact cause of fibroids isn't fully known, but hormones like estrogen might encourage their growth. Other factors that increase your risk are being older in age, especially if you're 40 or older, you've gone through puberty before the age of 12, you're overweight, you're a black woman, and black women are 3 times more likely to develop fibroids than white women, having a poor diet or drinking excessive alcohol, and finally having high blood pressure. Now, in terms of symptoms of fibroids, as I mentioned at the beginning of this video, you might have fibroids and not actually have any symptoms. In fact, you might only discover that you've got fibroids during a scan for another reason. This is known as an incidental finding. However, when you do have symptoms, they can include you having heavy and prolonged periods. Now, this can potentially lead to something called anemia, which is where you've got low hemoglobin, which causes symptoms like tiredness, dizziness, and breathlessness. You might also find you have irregular or painful periods, a swelling or bloating sensation of the tummy, pain in your lower tummy or a pressure-like feeling, bloating or constipation, or a frequent or urgent need to pee. Finally, you might notice potential issues getting pregnant. Now, if you've got any of these symptoms or signs, you should see your doctor. Many of them are common and they can be caused by other things that are not fibroids, but nonetheless, it's worth seeing your doctor to find out what could be the potential underlying cause. In terms of what happens when you go to see your doctor, they'll ask you some specific questions about your symptoms, like what they are, how long they've been going on for, and how much they're bothering you. They will then ask to perform a physical and vaginal examination, where they'll examine your tummy by pressing on it, and then they'll check inside the vagina using a gloved finger to see if they can feel anything whilst also pressing on the tummy at the same time. Now remember, you're always welcome to have a chaperone, which can be another professional or a family member or a friend in the room at the same time. So please don't feel embarrassed about asking for this if this is going to make you feel more comfortable. Now, following asking questions and doing an examination, your doctor might request tests like blood tests, an ultrasound scan, and may ultimately refer you to a specialist called a gynecologist to explore and investigate things further. Now, I'm a general doctor and I'm not a specialist in this area, so in the next section where we discuss treatment, I'm not going to cover treatment options in huge amounts of depth. This could be a whole detailed series of videos in of itself. Instead, I'm going to cover some of the broad treatment options that are available to you so that you're aware of lots of different options. And if you want to learn more about the specifics of one particular type of treatment, I'd encourage you to do further reading around this and speak to your own health provider. So generally, treatment for fibroids depends on your symptoms, the size and location of the fibroids, and whether you want to have children. Broadly, we can break down treatments into conservative treatments, so things like medications, and surgical treatments. Now, medications for fibroids can include over-the-counter pain relief like ibuprofen, but remember to always read the instruction leaflet before using it. Next, medications like tranexamic acid, contraceptive pills, progesterone, and intrauterine systems, also known as the IUS or coil, can be used to reduce heavy bleeding. Finally, certain medications called GnRH analogues and ulipristal can shrink fibroids by lowering estrogen levels. These are often used before surgery. In terms of surgery, there are lots of different options. The first is something called myomectomy, which removes fibroids but preserves the womb. And this option is suitable for women who want to have children. On the other hand, there is a more radical operation called a hysterectomy, which removes the womb, but obviously this would prevent future pregnancies. Transcervical resection is an operation which removes fibroids growing into the womb using a hysteroscope, which is a thin tube with a camera inside it. Endometrial ablation removes the womb lining to reduce bleeding, but again, it's not an option for women who want more children. Uterine artery embolization blocks the blood supply to fibroids, causing them to shrink, but again, this is not recommended if you plan to have children. Finally, MRI-guided ultrasound surgery uses ultrasound waves to remove fibroids with uncertain effects on future pregnancies. Now, your doctor is going to discuss the best option for you based on your needs and recovery time, and this should be a joint discussion between you and your doctor. Finally, whilst most women don't experience complications, some possible complications include constipation and urinary problems that can arise from large fibroids that press on the bowel or the bladder, anemia from prolonged heavy bleeding, infertility and miscarriage, challenges during childbirth like the baby being born in the breech position, meaning that its feet come out first instead of the head, and pain from twisted fibroids on stalks, which might require surgery. If you've had or you have fibroids and you want to share your experiences to help others, please do so in the comments section. And please remember, always consult your doctor if you do have concerns about fibroids. And for more resources, please check out the description box of this video.